それでは、ただいまから、
We would now like to begin the afternoon session, and this will be the second inspiration talk session, continuing from the first session in the morning.
それでは引き続き稲庭さんよろしく。
So Inaniwa-san, please.
はい、では午後の部始めたいと思います。
Yes, I'd like to begin the afternoon session.
2に入っていくんですけど、
We're now entering our inspirational talk second session, and here in this session, we will first hear from about the House of Memories, the project of National Museums Liverpool. This is a big project, and we'll hear about this project. Also, for the two galleries in London, St. Iris and Liverpool, Tate Gallery,
お話を伺って、
we will have the opportunity to hear about Tate Gallery's activities as well. And we'll first like to hear from Carol about the House of Memories. Carol, please.
ください。
Good afternoon, everyone. I'd like to say that our suitcases have arrived. You can all relax into the day now. It's an absolute pleasure to be here with colleagues from the UK. And just before I start, my takeaway from any good conference is that I like to take notes and learn things, and I think that's where we're all equal in the room. We might be sharing special projects and initiatives, but actually every single day I learn something new in my job. I've already learned something from Ruth, so we are united in our quest to learn together. So just wanted to share that. So I'd like to begin. Okay, so my name is Carol Rogers, and I'm the director for House of Memories, which is an international dementia awareness program, which has been designed and led by my organisation, which is National Museums Liverpool. And we've developed the program, as Soaka said, over the last 10 years across the UK. We also have a program in the USA and in Singapore, and I'll tell you more about that as my presentation goes on. For the museum professionals in the room and cultural partners and art galleries and creative people, this next bit of my speech will be really familiar to you. We all, in our various different ways, genres and collections that we hold, we utilise museum objects and their collections and exhibitions and the connections that they have with personal memories, family lives, and community identities. We might not feel at this moment that we do that in a formal way, but every time you walk through your venue exhibition and you reconnect with an object or a space that you haven't seen for some time, that's a connection with your memory. There's a familiarization. There's now I know why I enjoy this space. And that's what happens in House of Memories. We've designed our program to inspire, encourage, and develop person-centered approaches to dementia care. Now, that isn't traditionally within the museum. But within this context, museum collections and objects are curated via House of Memories to act as a catalyst for conversations and communication between people living with dementia and those caring for them in the health and social care sector, family members, communities supporting those living with dementia. My personal interest in House of Memories began through a family experience of dementia, which prompted me to affirm my belief that museums of all shapes and sizes, different and diverse collections, we are all uniquely placed to look after and represent our great cultural memories, be they historical or from yesterday. And by doing so, museums can play a valuable role to support the global dementia community. The House of Memories began in 2012, and our central aim was to create an accessible programme, a resource co-created with people living with dementia, their care providers and health networks. As you may or may not know, the impact of early onset dementia, a diagnosis, can create a sense of a shrinking world and can negatively impact upon individual choice and long-term independence. House of Memories is designed to empower people diagnosed with dementia through the creation of personalised digital experiences designed to connect their memories with museum memories. The programme is multifaceted, and I just want to say that it's taken 10 years to progress to what I'm sharing with you today. So I don't want to give any of you the impression that this happens overnight. It's a long, as Ruth said, a long, committed, focused, and very determined when it comes to funding, focused endeavour to realise a meaningful and insignificant tool for the dementia community. I'm going to play a short film now that shows you the programme in its entirety, but remember, you're looking at 10 years of development.
Welcome to our home, our house. To National Museums Liverpool's House of Memories. Our multi-award-winning, museum-led dementia awareness programme. House of Memories is a social asset that is changing care through culture. Created for and with people living with dementia, their caregivers, families, and the wider dementia community across the UK and internationally. Museums are experts at looking after memories, and we recognise the value and significance of those memories, those life experiences, those stories that make us all who we are, especially for our ageing communities and people living with dementia.
I've noticed there's lots of different age groups here, ethnicities, and the lovely thing is that you're meeting people who are involved with people with dementia already, and they will give you answers from experience to questions you have. It's a great way to learn and to connect with other people too.
Memories are all that we've got. They're our hope. If we lose all our memories, we lose our hope. If you show us something from the past, it just triggers everything in your mind.
House of Memories is all about engaging and connecting with people living with dementia, sharing memories through objects that resonate with their life history and empower and recognise their contributions.
You just realise there's an awful lot of people like us. They're helping you a little bit, cope with it, that you're not on your own.
It's made me realise that you're just as important as the person with dementia, because you're living with it as well.
What have you got in your memory box? You've got your Everton tickets, you've got a penny on the day we got married, you've got your used to do marathons, marathon medals. You talk about it, don't you? So that's good, Peter.
I nearly got it.
You nearly got it right. You come alive, don't you, somehow?
This need to connect and engage with the dementia community has never been greater. As a cultural organisation, House of Memories is committed to listening and responding to those ever-changing, ever-growing needs. We respond to the need to support and equip health and social care professionals via our award-winning in-person and online dementia awareness training. We respond to the need to support and give voice to those living with dementia, their families, friends, and the wider community. We have our ongoing open invite to our very popular museum-based Family and Friends Dementia Workshops and our dementia-friendly memory walks. And we respond to the need to take the museum out, beyond its walls, to the communities themselves. When you can't get to our museums, we'll come to you with On the Road. Our innovative mobile museum creates memorable, digitally interactive experiences for socially isolated people and people living with dementia in their own neighbourhoods. Our bookable, culturally diverse memory suitcases containing photos, memorabilia and objects that help promote conversations about memories of days gone by. And our award-winning My House of Memories app, which allows you to explore objects from the past and share memories together. The first of its kind anywhere in the world, and co-created with people living with dementia.
I can sit with my granddaughter and go through those memories. I think that technology and apps are the really way forward.
We respond to the need to share the success of our programme with culturally diverse communities nationally and internationally. Our vision is to be the world's leading museum dementia resource. And through consolidating existing partnerships and building new relationships with cultural organisations, health and social care providers, funders and supporters, House of Memories will continue to grow, to adapt and to evolve. We will continue to listen and respond to the ever-evolving needs of the dementia community itself.
There's nothing better than remembering things because you're thinking, I haven't forgotten everything, I'm still here. It makes you feel like you are still you.
We've been developing. You might have heard in the film that we've got a sense of a strong mission. I just want to explain the mission. The mission for House of Memories is to be the world's leading innovation for the dementia community. That's not because we're on a massive power trip and we want to be the biggest museum in the world. It's because we recognise that people across the world living with dementia can be united, can be shared experiences, there can be shared memories that unite people culturally. So, for example, our work in Singapore has united with Singaporeans living with the UK. There's a diaspora of Japanese people all across the world. Sadly, some of them may well be diagnosed with dementia, and House of Memories can connect with you wherever you are. And our vision is explored through 4 distinct areas of work. Really rubbish on this, aren't I? There you go. So we really have started to develop dementia-friendly digital technology, and co-creation is at the centre of our work. Everything that we do is explored through people living with dementia. They have the lived experience of dementia, we don't. So a bit like Ruth, everything that we do, before we design anything, create everything, it begins with a conversation where we listen and we learn as cultural organisations first and foremost. Then we curate and then we develop. We've also found in our journey with House of Memories that as curators, educators and communicators, sorry, I need to go back one there, we're very good at looking at dementia training and how that might support the wider community. House of Memories is based upon a real-world challenge, and that challenge looks at the ageing population. It also recognises, and I'm not sure, and I think it is the same in Japan, we have a very fragmented dementia diagnosis across the UK. There's a stigma associated with a dementia diagnosis. Elders, our grandparents, our parents, they don't want to be diagnosed with dementia. It feels like it's a deficit, a negative on their lives. But it's only through diagnosis and understanding how diagnosis can help support the person that actually the world will become a better place for the dementia community. And a bit like Ruth, we start with professional health carers to identify where that diagnosis need is. Technology is something that is really important to House of Memories, and we know that there is limited health sector recognition for the work that we do engaging adults. So a big part of what we've undertaken the last 10 years is quite a rigorous and robust research programme, which I'll come on to in a minute. And technology isn't always mindful of an ageing society. Technology is a fantastic tool, but without the content of collections, without the richness of creative engagement, it's pretty meaningless. And we, as cultural organisations and creatives and artists, we're content rich. We have the magic that allows technology to flow. So as the owners of the content, we need to be challenging technology. We need to be challenging the innovators of digital tech to think about our ageing society in a more meaningful way. And as you saw on the film that I've just shared, not for 1 minute and not at any point in my journey with House of Memories have I ever encountered sitting with an older person and they haven't been able to use our app. And we work with older people right across the world. And we probably got a preconception that older people can't engage with technology. Well, they can, as long as they have the support and the interaction and the confidence to do so. So I would say to you, if you're working with technical partners, make sure you become the voice of your audience and don't get carried away with the whizziness of the technology. Make sure it's working for you. And also for House of Memories, and you've touched upon this, academic research is absolutely key. And when this work began in 2012, there was very limited academic research in the UK. Ruth touched upon social prescribing. That's very much a new terminology for us the last 4 or 5 years. Every single one of you that's working in a venue is social prescribing now. And so these terms and these opportunities, don't let them feel like they're barriers to overcome your practice and not get started. You are all social prescribers because you're using content, creative works to connect with people. That's what museums do. We're caretakers of everyone's heritage. We don't own the heritage. It belongs to the people. It belongs to the nation. So again, don't let that limit you in your ambition or your aspiration for the groups that you're working with. So museums, why museums and memories? Well, we have great expertise as curators, archivists, conservators. We're just really good at looking after our nation's collections. So that means we're really good communicators. I've had a brief look at, had the pleasure of just taking a brief walk around the museum and the gallery today, the National Gallery. And everywhere you go, you can see evidence of the communication skills that we have. Sometimes we forget that because we're very embedded in the academic understanding of the work. But without the ability to communicate well, and I say this respectfully, it's a bit of a waste of our time. Because if the public can't connect, can't benefit and enjoy the work that we do, we're really only doing it for ourselves. And I think it's a bit self-indulgent. We might be preserving culture, but why preserve culture if the nation can't enjoy it? I am provocating here, and that's okay, isn't it? We did say we were going to do that. The power of objects. Objects tell stories, collections, exhibition, artists. It's really great to peel the onion of the object and really get inside it and enjoy the meaning behind the object. And we use that all the time in House of Memories. And community engagement is absolutely key. For the first 2 years of my research into the House of Memories programme, way before I designed any of the content with my team, I went to health and social care university clinical conferences to learn about dementia. I think it's really important that you step into the shoes, step into the world that you're trying to connect with. And I learned an awful lot from that. And the wider community of older people beyond dementia is really key to our ongoing growth and success. If you design a dementia-friendly intervention in your museum, that doesn't exclude anyone else. It's still for everyone. It just means that the older people and those living with dementia can enjoy the experience as well. So again, you know, when we think about dementia, it's not a deficit model, it's an inclusive model. I'm just going to briefly touch upon a couple of programme strands that you saw in the film. Every one of us that is venue-based has an asset that is a museum or gallery or a collection or a venue or a creative space. It can even be a theatre, a concert hall. All of us open our doors and welcome the public in. And House of Memories identified that that asset could be tweaked and modelled to really work well for the dementia community. So we offer monthly dementia-friendly walks around our collections. They're designed to be paced and to be delivered in a way that people living with dementia are confident, first and foremost, to attend, and then secondly, are confident to really enjoy the experience. And they're very, very popular. They're always oversubscribed, and we always have a waiting list. We also have object resources. We put our objects into suitcases and boxes. You might do this on your gallery now. You might do this in your creative space. And the difference being, all of our suitcases, whoever they are for, are dementia friendly. Doesn't exclude anyone else. Our school groups use them, our older adults, our young academics. They are for everyone, but they are dementia friendly. The app is something that we developed about 5 years into our programme, and it came about because up until 2016, all of the work had taken place inside the museum. So it required the community to have the confidence and the support to find their way to our front door. We recognise that our collection is so rich, so diverse, we could reach many more people if we invented a way to digitally recreate a collection experience within a dementia-friendly format. Now, as you're sitting here today, I'm very pleased to tell you that you can download our app. It works on all iOS and iPhones and iPads. It's called My House of Memories, and you can download it anywhere in the world. And it's completely accessible to the dementia audience and also to you. And it includes living history collections. Memory for us, the timeline for memory in the UK is living memory from 1930 until yesterday. So the photographs that I'm taking today, I was taking photographs of Ruth, they would go into my memory tree. I would have a digital record of this moment that I'm sharing with you. There's music in our app, sound effects, there's film and video. As you are all familiar with phones and iPads, it's touch screen and far more intuitive for people living with dementia than a PC or a screen. A keyboard is complicated, an iPad is simple. And we tested it again and again with clinical academics, with the dementia community, to really ensure that the app works for people living with dementia. And I have to say, it really challenged us, because as a museum group, we had our framework for digital recreation that was a traditional way of reproducing our content on gallery and with a host of other apps that we had. House of Memories really challenged our design team and our creative team to listen to what the dementia community wanted. And I'm really pleased to say that now we have over 40,000 users of our app. So I think we got something right there. And it's growing and it's evolving all the time. And that's another takeaway for you. You need to be the voice of the community you represent within your organisation. You need to find the confidence to challenge, to empower, and really be the advocate for the group that you want to engage with. Connect My Memories is an initiative that we've developed that we take out into communities. Not every community and not every family can afford an iPad, so this is a free loan service. So we have 40 iPads that we loan out to deprived neighbourhoods. People can have access for the iPad for as long as they like, and we run training sessions to help them grow their confidence. Again, very popular. On the Road, you saw there on the film clip, this went live in 2021, and quite literally we've designed a programme that can take an immersive, interactive, 4D smell, sounds, objects, touch into care sittings, into hospital car parks, into university campuses. We take it right across Liverpool. It's really popular. It goes out 2 days a week, and hundreds of elders have benefited from a museum coming to them. The global reach of House of Memories I've touched upon. We designed a project in Liverpool that we knew we wanted to develop at scale. Now, I don't know how your funding works, but quite a lot of the work that we had developed up until this point, it was funding-led. So we'd have a project that would run for 6 months or 8 weeks or a year. But once the funding had ceased to exist, the project would end with it. And that's a reality, absolutely, for all of us. But we wanted to design something that would work at scale. So my day job now is to raise money and to bring in the means to keep House of Memories going, so that we can keep that project evolving. And as Ruth said about Paul Hamlin, it's quite challenging, and you have to put in a lot of time and legwork before you get the grant. So again, time is precious, but I do think it's meant that I sit here now in 2023, and I have the great privilege of saying to you, this has been running for 10 years, and I can see no reason why it wouldn't run for another 10 years, although it's quite hard to keep going. Have a programme in Singapore. What was different about Singapore, which may again be of interest to you, is that for the first time we started to introduce bilingual packages. So the app that you're going to download, you'll see there's a flagged Singapore, and when you go into the Singapore package areas, they are in Chinese, Mandarin, Tamil and Malay. Last week I was in Wales with the Welsh Government. I've worked with 14 museums across Wales, and I launched House of Memories Cymru, which is completely Welsh speaking. And the reason why we're interested in language diversity and language choice is if you are diagnosed with dementia, and in the UK, if English isn't your first language, you might struggle to access health services and resources because your dementia has returned you to your first language, and that can be a barrier. So we think it's really important that language choice grows with the development of House of Memories. I'm just going to skip through a couple of slides. I wanted to touch on how it works, and I've only got 3 minutes, so I need to be really concise with this. From the very beginning, we worked with an academic research partner at the University of Liverpool and with an acute care hospital trust called Merseycare. And we created what is a knowledge transfer programme, which places the person living with dementia as the expert. And the programme follows these 4 principles: startup and planning, which is the conversation and the exploration; content development; intervention and protocols development, which means at every stage you reflect back to see if the approach is working; adaptations, absolutely from beginning to end; and then you have your first draft model. And we apply that framework to every development we undertake for House of Memories, and it's become a very solid foundation. And it's actually an accredited methodology within clinical dementia settings developed in Europe. And the University of Liverpool is only one of 4 accredited knowledge transfer programs in the UK. So we felt really privileged to be part of that for our work. Health sector research is absolutely a key moment of learning and development. I touched upon the community and I've touched upon the person living with dementia. In the UK, if you compare funding for museums and cultural organisations with funding for clinical and health sector interventions, there's a massive difference. And I knew that we were producing and developing something that would really speak to clinical practice. It touches upon the point you made earlier that, you know, our well-being is more than our nutrition, our sleep, and our exercise. It's about our healthy minds and healthy mental health. And in the UK, there's a lot of research funding around that space and clinical development. So I undertook, and this on screen, you're seeing a snapshot that I've done a lot more than this, but I just wanted to give you a sense of between 2017 and 2021, in the pink column, you can see the different research areas I looked at across policy and strategy for clinical health and dementia care in the UK. The second column is the sources that I really delved into. I made it my business to understand, to have meetings with specialists, with GP, with memory clinics. I immersed myself in their world. And from that, the far column are the strategic themes that came from that inform the development of House of Memories. And the point of sharing this with you is to say we have to step out of our comfort zones, have to open our minds to take in new information that creates opportunity for new intervention. You need to be the innovators. You have the richness of your collection. And in my experience in the UK and in Singapore and in the US, if we are at the forefront of that as a museum sector, great things and opportunities will come. And I've seen that amongst my practice. I see it on a daily basis. So influencing and progressing is important. And you can see that I'm just going to end on this slide. At the moment, this is my work plan. This is what I'm working on with my team. I've just launched a House of Memories programme with Yemeni elders in Liverpool, and it's an Arabic and English-speaking programme. I've just developed a programme in Wales. I'm about to launch this October training for 600 nursing cadets at the University of Liverpool. They're going to place House of Memories training at the core of their practice as students, which I think is a wonderful opportunity. Any football fans in the room? One. I'm working with Liverpool Football Club. I'm archiving their collections and the memories of fans into House of Memories. I'm working with the UK Army veterans. I'm just about to launch a programme with Chelsea pensioners. And then finally, I've just secured funding to develop a programme for the LGBTQ plus dementia community. So I wanted to end on that slide to show to you this work constantly evolves, is really rewarding. I would say to anyone in the room that's not, you know, for me it's dementia and it's working with that community. Wherever your passion is, wherever the opportunity is on your doorstep, take it. Be confident, be brave and be ambitious. Thank you.
Thank you very much. So you started when I visited in 2014 in Liverpool and met you. At that time, I felt your passion. So Carol, I felt your passion when I met you in 2014 and we had a good conversation. I remember that. It had left a big impression on me and I learned a lot about the program and I could feel the needs of the society for the kind of program that you have. And about a decade later, I'm meeting you again. And from here, I can see how steadily you have been enhancing your scope and also deepen the scope of your activity. And there are various stakeholders, various people who are related, and you have been reaching out to these various related people and worked with them in detail in very carefully. So that was left a strong impression on me. So your 10-year activity, I think last year you had a activity report online on the website, and so what the audience has seen right now, there were some videos that they've seen, but there are also other interesting videos that you're providing. And at Singapore, we can see how your activity is being expanded, and that's reported on your website too. So I really encourage the audience here to get more information on the website. So thank you very much, Carol. And so we've heard from Carol mainly about this program that focuses on the dementia patients and the caregivers and the families. Now next, we're going to hear from Mark from Tate. And it will be about the care, the young generations. A different perspective is what we can hear from Mark. So Mark, please.
Hello. Great to be here. And yeah, really thanks for the amazing welcome, hospitality. And yeah, great to hear our colleagues in the UK speak so well and clearly about the practice that I think is also so interconnected across our various organisations. I wanted to start by sort of giving a bit of an overview just about learning at Tate, and if you want a kind of approach, the approach that we have to learning at Tate. So, just got loads of different things to juggle here. So the way we view learning at Tate really is about how our galleries, our programs are really active and generative places for creative learning, really thinking about how we embrace the power of encounters, and especially encounters with art and people as a means to really inspire and realize and acknowledge our individual and collective potential. And I think collective potential is quite important in that, in terms of the kind of space of social and the connection with us as human beings and people within a space that's surrounded by art. But I think also just thinking also about how galleries and museums are kind of social spaces, and I know we're talking about social care, but there's something about that broader context of a social space. Creative learning is a frame that we use a lot in the UK, and I'm sure you use that here as well. So I just wanted to give you a sense of that in terms of what that means, creative learning, as I see, and we see Tate as this unique place for multidisciplinary creative engagement, a space that we champion learning, social and cultural growth. Fulfillment is a really important word in all of that. Through open art-based encounters that resonate, I think, with the rich cultural experiences that we all have. So how does the work and our experiences, this idea of lived experience outside of the museum, engage with what we do inside the museum? And then just sort of thinking about learning itself, which we often do not use the term education, and we use learning as this broad sense of capturing a process that we all engaging really as a method of adapting, improving, and gaining insight to be progressive, and the ability to be continuously shifting and changing our perspectives related to our experiences as we move forward. And then creativity and art, and this idea of solutions, meaning, space of expression, where we can produce actions to enable new forms of engagement to emerge. And I have ideas in there. I think ideas is a really important space in terms of where we work this idea of art and ideas. So there are kind of, if you want, sort of 4 areas that are really focused on that are interconnected. One is thinking about how we learn, and how impacting perspective through our program. There's a point about connections, which touches a lot on partnerships, but also connecting art and creativity to people through our programs. There's also encounter, which is really about representing that multidisciplinary, artistic and creative lived experience through our programs. And then, as I mentioned, ideas, and ideas about the future, inspiration, formats, knowledge, ideas also as an atmosphere, affirmation, and progression. Yeah, so just a bit of frame sort of the past context. I think over the past several years, the word care has emerged really purposefully, I think, just in terms of as we all pivoted, if you want, through the global pandemic, we all pivoted to new ways of working, and we somehow became aware of this idea of care, even though we were en masse really disparate and separated and distant from each other. I think care actually emerged in quite a sort of isolated and peculiar way, which in some ways to me seemed at conflict, but at the same time it was really interesting. So, you know, our organizations also spoke about usefulness. We were thinking at a time, how could our organization be useful? How could we produce programs to serve the public and be publicly accountable, which is part of our work? How could we work in different ways, especially when the hierarchies of need were so apparent, you know, during that period? So how could we, which was a question we asked ourselves at Tate, how could we make those absences visible within our institutions and online? Because we felt the sort of physical lack of presence, both in terms of ourselves, our collections, but also of our publics who we essentially serve. Many of us sort of paused to recalibrate, and we tried to reset and understand where we were, how this complex shift that we found ourselves in, how could we, as a learning department, with our resources and the arts, how could we support, adapt and serve people and organizations that we were so disconnected from? And with all of that and those contexts, I mean, I now sort of ask myself a question, and I think we should ask ourselves a question: have we sort of lost the meaning of the word care? I think, like, within our institutions and how much we use those terms, what does it actually mean to cultural institutions? What does it mean to the skills that we all have, you know? Is this actually a skill that we have that we should use? And can an institution work? And I understand that collectives and individuals obviously care, but can we talk about institutional care as a sort of body of care? And I say this because I think some of the realities of the skills we have, the training we have, and the training and skills that are required within cultural institutional context, yeah, just throwing that back at you just in terms of whether we can care as institutions. It's also crucial that we manage expectations of what care actually means within cultural institutions. And when I say that, I mean, what does it mean to our stakeholders, to artists, to audience, and to program contributors if we talk about ourselves as caring organization? I mean, it's a super complex space in terms of what those stakeholders expect from us if we say we care. As well as a range of ways that care might manifest itself in terms of individuals, groups, collectives, and cultural organization setting, we really need to sort of unpick what that means. And of course, many of our organizations, including Tate, have really strong procedures of care. I think in terms of even in the last 3 years, there are just so many mechanisms for care, training people, championing well-being and self-care. There are also loads of support mechanisms, signposting, so whether that's around well-being, whether it's about employment assistance, counsellors, lifestyle, advice on debt, health and well-being specialists, and even online CBT, which is cognitive behavioural therapy. So in a way, one could say institutions care in that sense, but I think when we talk more broadly about the cultural institution, we really need to understand what care means in 2023. As individuals, artists, cultural workers and researchers and colleagues, I know that we're all united in appreciating that care needs to be an embedded ethos and an approach for us to work, I think, beyond, as long as we don't work beyond our skills and abilities. And I think this is where, I think I've skipped ahead a few slides, but this is apparent to this slide, which is the idea that it's fine where it was actually, yeah. So saying all of that, next piece is about partnerships. And Ruth and Carol have mentioned this, and I'm completely part of this practice, that partnerships need to be long-term, absolutely essential. And this is why I'm sort of throwing this question about, can cultural institutions care? Because we really need to reach out to the expertise. We really need to get out of our comfort zones and understand who we are, who we need to work with. So approaches to third sector with cultural sector require really strong, intense, rigorous partnerships. Our partnership strategy always presents space for us to understand and negotiate how organizations can care or work best in the context of care. We can understand from the partnerships that we work with how we can be most useful. And I think really understanding that we need those specialist knowledges from partnerships, and I think collaboration, co-design, co-production, however you want to frame that, are core to all of that. We need to ensure that we create mutual benefit and really be in a position of serving our immediate local and local organizations. So with that, some of our principles are really around partnerships, how audience partnerships and networks are completely essential to how we work. So establishing long-term partnerships to enable us to gain a deeper understanding and a better representation of the varied and interconnected lived experiences of people in our cities, connecting with partners that align with our strategic audiences. I think at Tate, some of our strategic audiences are families and young people, with a focus on intergenerational and with Black, Asian and minority ethnic groups, low socioeconomic partnerships and networks. We really identify the priorities of local audiences and really thinking about how we consider residential, grassroots, corporate, public and cultural sector organizations. There's a key piece to that, which is how we adopt partnerships to networks and networks to partnerships. And the idea is that how do networks become partnerships and how does a partnership remain within a network and how we build that over many years. And I think those relationships and that support to really extend and amplify the reach and impact of our work. And of course, crucially, how we really illuminate and reflect our locality. And I say this because it's super important. I mean, in London, we live in, I don't want to use the term multicultural, but a very diverse group of people. If we're talking about BAME, people from backgrounds, it's probably now about 42%. But yet, if you go into any of the Tate sites, we roughly mark around 20%. And then we think about the staff who work at Tate, for example. You know, lots of work is being done to think about workforce diversity of audiences. But I think within partnerships, we really have to think about who we're representing, who we want to represent, and how that really maps out within the structures and partnerships that you pull together. So how can we represent our local demographic? How we collaborate with partners, developing with local people through mentoring, placemaking, projects, and public commissions as well. I think reciprocity is key in all of this. So what is the real clear give-get when we are working together with partners? How is it mutually serving each other? Or how sometimes do we distribute our resources to enable other organizations to be able to work with us? And we found a lot of that, especially post-COVID and during COVID. We're really thinking about this idea of usefulness, both in terms of our spaces, as well as the other resources that we have. So now I'm just going to talk about New Town Culture, which gives an example of some of the work that we've done. And really it was about building a resource to support social care practice in galleries and museums. And what I'll say is that New Town Culture is a program led by Marika Steedman. Marika Steedman is a senior curator for the program. It was also led by a senior curator from our team, Rachel Knoll. New Town Culture is a cultural program exploring the interrelationship between cultural practice and social care services. And it's a really important project, actually, and you should have a look at this work. New Town Culture is the name of the program. And it's based in London Borough of Barking and Dagenham, again a really important borough in London in terms of socially engaged art practice, and also really looking at, if you want social work practices, they work really closely with the council. And what I say about New Town Culture is that they're actually based in Barking and Dagenham Council, so it's quite an interesting model. So the aim of the program is to explore how artistic and cultural experience can enhance the work of social care practitioners, and thus helping to support children and young people in need of social care. So to support this, there's been research done through Goldsmiths University on leading a range of knowledge exchanges between social care and cultural practitioners. They've been, through this and several reports, they've developed 5 concepts that are connecting spheres, if you want, so points of connection across social care and cultural practice. And the 5 areas really underpin some of the questions and the role of the cultural organizations such as galleries, museums, and how important they can find ways of connecting to enable support for young people. The project really wanted to outline a new resource that enabled and encouraged social care staff to use publicly funded cultural spaces to support their young people. And it's quite important just to think about that kind of, the idea of free museums, especially in the UK, and how important that kind of public responsibility is in all of this, and how we can be really important places for supporting cultural work. So I'm just going to tell you a quick piece about the brief. First piece was to think about developing a tool for social care staff. So that could be carers, it could be youth offending service workers, it could be social workers, family support workers, and how working in the local authority with 12 to 21-year-olds, how we can enable these resources to be an important catalyst, if you want, for strong support to enable this work that Goldsmiths and Newtown Culture were developing. So the aim of the tools were to enable staff and young people to build confidence and step over the thresholds, to make a case for this idea of free spaces, free public spaces, safe spaces, venues of inspiration for practitioners and young people, to also support the confidence building of young people, and even just thinking really about how you can use the resources, the facilities that were offered in these spaces. So whether that's toilets, free displays, hangout, social spaces, and really understand that these facilities could be used as safe spaces, they could be used spaces to communicate, places of inspiration, spaces to tackle difficult conversations and feelings, spaces to build or consider and explore cultural identity, spaces to explore belonging, and spaces for ideas, spaces that you can do, spaces that you can shift and consider other perspectives. To develop the resource, there were lots of conversations between social workers, carers, young people, artists, and of course staff at Newtown Culture. We wanted the resource to be designed to be used online, downloadable tool for the Newtown Culture and the Tate website. And just speaking back a little bit about these 5 points, which really led the development of the resource. First one was hopeful disruption, and this was really referring to the artistic act, this idea that artists, social care workers, practitioners could challenge the conventions, the ways of thinking, of being, of talking and acting. Radical hospitality. This was really about the welcome. What could you do within any given place to really radically welcome and open a space up for young people? Ceremony. So this was all about the process, if you want, sequence, repetition, and really this was about symbolizing the significance of the engagement. Unlocking cultures, which was really thinking strongly about the meaning of opening the possibilities of new ways of thinking, really considering how you could use this new resource as a way of forming belonging and self-worth, and not knowing. And I think this is really about meaning, understanding how you could enable different stories to illuminate or to emerge through sort of seizing a moment of an encounter and thinking of this encounter as a different space, perhaps sometimes uncomfortable, but actually a space where you could embrace not knowing. I'm going to show a video quickly, probably for a minute, and then I'll probably end on that.
For some people, stepping over the threshold of a museum or gallery may seem a daunting prospect. So we'd like to share some thoughts, which we hope will make you feel welcome. There are facilities in the gallery to help you have a comfortable visit. Alongside a cafe, cloakroom and bathrooms, there are spaces to sit inside and outside the galleries. If you are visiting with someone who is disabled, there are things to support their visit, including lifts, large print guides, and audio format information. There are also gallery staff walking around who are there to help and will happily answer questions about both the facilities and the artworks. We hope to see you soon.
Yeah, thanks. Just wait to stop there and just a few last words. And I think you get a sense of, this is quite an important video in terms of how it might break some of the, if you want, many of the thresholds and the barriers into museums and galleries. But I just want to end by just saying, finding sort of reciprocal, mutually beneficial partnerships and enabling really thorough and rigorous reflections on who we are as cultural organizations and the roles that we have to play, understanding our abilities and the realities, if you want, of the support we need to serve from healthcare experts, partners, individuals, collective organizations, grassroots and others, where we need to, again, move to that space where we are considering how we serve, the skills we have and the resources that we have in this context is super crucial. And I'll stop there.
Thank you very much. So in museums, there is place, there is collections, and that belongs to everyone. It needs to function as belonging to everyone. But within that context, Carol, what she talked about, what Mark just talked about, how we connect all of that up with many, many other things, it's very clear that great efforts are being made on these fronts. So thinking about resources, how do you get resources out there to be more effective, more beneficial, to spread that out further? That's very much what I think you're both engaged with. So I think Mark has just been talking a lot about that, the word care. So when you think about care for museums, galleries, what does care mean? And within that, just a quick word from each of you, because we don't have that much time, but I'd like to ask for Carol. When we say, we're specialists in providing care, museums are about caring for memories. That's what we do. It's not care in the general sense, but we are there to care for memories. That's what we're the experts of. Listening to what Mark has just described, when you think about museums and what we can do, what we should do in terms of care, what do you think very quickly does that mean?
I'm on. Well, I think, Mark, thank you for that. I really enjoyed your presentation. I think what unifies us all is thinking beyond our role of caring for the collections, caring for the exhibitions, the buildings, thinking about what are the barriers to engagement for the collection care to be meaningful in people's lives. So for me, my interpretation of care is beyond the walls of the museum, and colleagues have touched upon this, thinking about how we as practitioners can perhaps, and you just said this more, challenge ourselves a little bit, not to sacrifice our professionalism, not to sanitize the collection, but actually to create those bridges for connectivity and enjoyment, and to care about the collection in a way that is measured by people's engagement as well as our professional outputs.
Thank you very much. So Mark, up to now, in your projects that you've been engaged with, particularly with younger people in society, when you think about your activities now, what kind of reaction do you get from younger people about care? That younger people, do they feel that they're being cared for? What is their response to care?
I think that's a great question. I think what we find now is that actually care, and this is why I threw that question out there, which is because it's really complex. I think I would say younger people want more care. They want organizations to understand, if you want, their lived experience much more. And actually, when we think about, let's call it a professional practice, they want that lived experience to be engaged with that professional practice. I think generations before, you might separate work as much as you can from your lived experience, your well-being, your kind of emotions, let's say, or your emotional experiences with family and friends. I think that young people are really, really driving and have driven to that, and I think it's been great on many levels, and conflicting in some, that actually they are holding organizations to account in terms of what does well-being mean, what does care mean. I didn't mention in my talk, but I had a line about emotional labor as something that's also, a term that's been used in the UK about, the emotions that are demanded from you in a professional context. And I think those are really important pieces. So I suppose in short, I would say young people are asking for more from organizations around well-being, care, understanding a broader sense of a human being's lived experience. And I think that's why this work is so important, because that's where it's taking us, right, to a space that is about humanity and empathy, when we're talking about, if you want, sort of hard and soft objects of art and history, etc. So it's an important space for us to navigate,
はい、ありがとうございます。
Thank you so much. So I think we're now about to end our second session of Inspiration Talk. Thank you, both of you. Thank you, Carol and Mark.
はい、キャロルさん、マークさんありがとうございました。
Carol, Mark, thank you so very much. So with that, it closes out Inspiration Talk session number 2.